I'm June Gruber, an associate professor of psychology at the University of Colorado Boulder and director of this mental health expert series. I'm delighted to be here today with Dr. Gordon Nagayama Hall, a professor of psychology at the University of Oregon, about his important work on culture and mental health. So thank you for being with us today, Gordon.
Thank you, June.
I was wondering if you could start by telling us just a little bit about the kind of mental health research and work you do.
So broadly, what I do focuses on mental health disparities, and the disparities are people of color not using services and then not entirely benefiting from services once they come into treatment. So lately, my work has been focused on the personal relevance of interventions for people of color.
And how did you get started on this incredibly important work?
It's been kind of a long and crooked path. So my mother was a Japanese American who was in an internment camp because she was a Japanese American during World War II. And so she talked to me about her experiences and gave me a sense of what it meant to be an Asian American and more broadly an ethnic minority person in the United States. And as I began to study psychology, I understood that there was very limited literature and research on people of color and health disparities. So this motivated me to look into this. So as a grad student, my dissertation was on therapist-client ethnic matching in psychotherapy and the effects on outcome. But I wasn't able to pursue that work immediately after getting my PhD. So I did some other work in forensic psychology for several years, and then eventually was able to integrate my interest in culture with the forensic work on sexual aggression. And then more recently, I focused on what I originally sought out to do was to examine the effectiveness of psychotherapy with people of color.
So, in doing this work, which is really powerful, and for those who need treatment the most and are underserved, I'd love to hear more about kind of your career trajectory and along the way, what have been some notable frustrations or failures you've experienced, as well as, of course, successes you've been able to savor.
Sure. So, I'm pretty old and have a pretty long career trajectory, but my initial goal in graduate school was to work as a clinician in a community mental health center serving underserved populations of color. And while I was a graduate student, uh, the terrain changed. So in 1980, Ronald Reagan was elected president of the United States, and his administration began to dismantle the Community Mental Health Centers Act. So the goal of my career to work in community mental health centers was evaporating. So my initial job post PhD was in a state hospital, which still did remain intact during the Reagan administration. I was working with sex offenders, and I was interested in that work, and I think was important, but I wasn't able to integrate much work in culture. And then I moved to Kent State University in an academic position. I continued the sexual aggression research, but then I was elected president of the American Psychological Association Society for the Psychological Study of Race, Ethnicity, and Culture. And so I had to give a presidential address that involved culture. And I was interested in this, but hadn't really integrated it into my research on sexual aggression. So this talk gave me an opportunity to integrate my interest and examine cultural factors as risk and protective variables associated with sexual aggression. So that began a line of research where I integrated culture and sexual aggression. And then later, when I moved, so I moved to Penn State after the work at Kent State, where there were a number of psychotherapy researchers that got me interested in my original goals from graduate school to study psychotherapy and underserved populations. But I guess another frustration or challenge throughout my career is the relative uh, de-emphasis on funding of mental health disparities work. And my particular interests are with Asian Americans. And there are data in one of the JAMA journals that indicate that over the last 25 years, only 0.07% of all NIH funding has been devoted to projects focused on Asian Americans. And that isn't because there haven't been applications, it's because Asian Americans have not been seen as a group meriting funding or particular attention. And unfortunately, Asian Americans are the least likely group to use mental health services. And this has been a vicious cycle. They're not represented in the mental health system, so they're not studied, and research is not funded on this group. So that's been one of the major challenges. But fortunately, I have a group of committed colleagues and students who continue to pursue Asian American mental health despite these challenges.
So when you think of these challenges and sort of look ahead into the future, what do you see as the most important next steps for the field?
Well, I see mental health disparities as one of the biggest, if not the biggest, challenge facing the mental health field. We still haven't found a way to engage people of color in mental health services, and the outcomes for people of uh, 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 the mental health outcomes for people of color are understudied, and in some cases there's disparities in outcomes. So disparities in utilization, disparities in outcomes. So these have been persistent problems for at least the past 4 decades, and will continue to be challenges. And because the demographics of the United States are rapidly changing, these are urgent problems that the mental health field really needs to pay attention to and to catch up with society.
Absolutely. And so for those watching this interview today, whether students or scholars or the public, um, what advice might you have for them who are interested in this field and maybe engaging in it more as well?
So the advice I have, and this is not entirely tongue in cheek, but I tell my students this: first, be a good person; second, work hard; and third, get famous. And I start with being a good person because that cuts across all areas of one's professional career and one's life. It's important to be a good person and to treat others with respect and work together with others and not simply self-promote. Working hard is important. I think most people understand that, and most people do that. And then the get famous part is the last thing. And unfortunately, I think in our field, people's priorities are reversed. Getting famous, working hard, and being a good person. It's that order rather than being a good person first.
I really love the advice of like putting being a good human being at the forefront. And I think that's some of the best advice you could give someone interested in the field. So thank you so much for speaking today, Gordon. This has been wonderful and really appreciate you taking the time.
Thanks for having me do this, June, and thanks for doing this series.